on? Oh, no. Yeah. Good morning. Habari sa asubuhi. Thank you very much. I would like to start by saying a huge thank you to Professor Regina Mutave and her team, so Ben, Joy, Steady, for inviting us to be in Kenya this week. We are very happy to be here. We have been very welcoming, warm welcome everywhere we go. So that's very exciting to be here. And also, thank you very much to the organizers of the Kenya Dental Association Conference for having us here, for giving us the opportunity to share our program here. So yeah, it's really exciting to be here with you all, and to you for being here, for attending this session. So thank you very much as well. So for the first part of the presentation, we will give you guys some background about the core program, some context of the program. And for that, it is my pleasure to introduce Professor Richard Watt. So Richard is professor in dental public health at UCL in London, and he is the PI of our core program. So over to you, Richard.
And welcome, everybody. So what I'm going to be doing in the next 5 minutes is give some background to our research, our global health research project. And our presentation fits very well with the speaker that was first part of the session about the FTI, about global agenda, and it also fits beautifully into the presentation on research and the importance of research to influence policy. So, in terms of a global perspective, back in 2019, The Lancet, which is the top medical journal in the world, published a series on oral health, highlighting the global importance of oral diseases, the diseases that many of you are treating every day of your lives. And they, in their editorial, said oral health was at a tipping point. And in that 2019 Lancet issue, there were papers covering the public health significance of oral diseases in terms of prevalence, impact, costs. And then there was a call for global action to raise the profile of oral diseases amongst policymakers globally. Since 2019, there has been a significant shift with the World Health Organization that has now placed much more priority on understanding and addressing oral diseases as a core part of their business, both in Geneva and across their regional offices around the world. So in 2022, there was a WHO resolution passed, and the country of Sri Lanka was the main instigator of this policy change. And WHO and Dr. Tedros, Director General of WHO, stated explicitly and publicly that WHO was now going to start acting on the need to tackle oral diseases across the world. So the Global Oral Health Action Plan was published with a range of different targets. And in the Afro region, Yuko Makano, who works in the WHO region, has helped to coordinate action across the Afro region around this very agenda. Last year, the first global meeting happened, WHO meeting happened in Bangkok, and there was a large delegation of African policymakers, both oral health chief dentists, and very importantly, NCD leads for Africa all came to Bangkok, where we held this very high-level meeting, moving forward, thinking about policy change based upon research, and that took place last year. And part of the WHO's global targets moving forward, there is a series of objectives with separate targets. And one of those targets is about capacity building, improving affordability and access to dental services, but also the topic of research and the need to improve the quality of research in oral health. So those are all the positive changes that have taken place in the last 5 years. However, in the last 9 months, there's been some major challenges that have affected progress with policy. So political changes in various countries have changed the focus of policy and funding across the world. And in particular, WHO has been affected. Oops. Unfortunately, Donald Trump has. The impact on oral policy has been significant by the changes in the US administration. So funding for global development research, funding for global health programs has been changed as a result of these geopolitical changes taking place. And in particular, our colleagues at WHO, their budgets have been decimated. So within the oral health program, the significant budget that was dedicated to oral health has been reduced significantly. So these negative changes are having a direct impact both at WHO, but also across their programs around the world. Another major challenge in terms of the sort of geopolitical changes is increasingly politicians questioning the validity of science and evidence. So we now have a Secretary of State in the US and the Health Department who is a vaccine skeptic. He does not believe vaccines have scientific evidence, and he's making policy decisions not on science, but on his personal views. So these changes that are happening in several countries around the world are a major cause for concern for those of us working in public health. Another major challenge is the increasing evidence we have on the global burden of oral diseases. And our first speaker in this session from FDI mentioned the evidence there. So the latest estimates from the Global Burden of Disease study, published in The Lancet in March of this year, has put a figure of 3.7 billion people around the world being affected by untreated dental caries, severe periodontal disease, oral cancers. And even of greater concern is in regions such as this around the world, in many low and middle income countries, the significant increase in oral diseases is marked in these global burden of disease studies. So this background is relevant to our study, our program of research that Carol and Regina will explain now. And linked to this is concerns that 21st dentistry is not fit for purpose in terms of tackling the burden of these oral diseases. If it was, why do we have 3.7 billion people around the world with untreated oral diseases? Oral diseases are preventable, but people are still suffering the consequences. So let's now hear from Carol about our core program that is hoping to increase capacity on research.
Thank you, Richard. To place the core program, our program, in the context of global oral health and also in a broader geopolitical context. So let me now tell you a little bit more about the core program itself. So as you can see here, let's start. CORE stands for Community Focused Oral Health Research for Equity. And this program is funded by the UK National Institute for Health and Care Research, NIHR, and is a cross-country collaboration between Kenya, Brazil, Colombia, where I'm from, India, and the UK. And our aims are to establish equitable and effective research partnerships across the partner countries, to assess oral health inequalities, so how they are produced, the patterns and mechanisms behind them, to determine the influence of commercial determinants on oral health. So, just as a reminder, commercial determinants of health, including oral health, are those strategies that the companies use to promote their products, even though they are harmful to health. Well, that's the simple definition, but you know what I mean. So that's commercial determinants on oral health. Also, we are interested in assessing the economic burden of oral diseases and opportunities for oral health system reforms. And lastly, yeah, sorry, to co-produce interventions with our communities to improve population oral health and reduce inequalities. And that last bit, the co-production of interventions, has been the subject of many of our discussions this week in our meetings here in Kenya. Now, in terms of our values, we think that novel community focused approaches are needed to kind of counterbalance and challenge the status quo. Richard presented what's going on in the geopolitical context. So we think those approaches are urgently needed to challenge the dominant Western narratives and approaches in dental public health and in oral health in general. We also think that it's important for us to have the values of equity, diversity, and inclusion across all the components in our program, respect, transparency, and trust between us, our communities, all institutions, and collaborators who are part of the program. Also, an equitable collaboration. So, this idea of having equal roles and equal, participation across the research and other components. So, that's also key for us. Mutual learning. So we are very much guided by this idea of learning from each other, learning from our communities, the institutions that they take part in this program, all our collaborators. That's a principle of value that guides very much our activities, and then capacity building and strengthening. Let me now introduce our program management group. So it's a group of people across different countries who collaborate together, and this group meet here in Kenya this week. So in the UK, Professor David Conway at University of Glasgow, also Professor Al Ross at the Staffordshire, at UCL, Professor Richard Watt, who just heard from, also Chantel and Louise, Dr. Michelle Stennett, who is here and will be in the discussion, Professor Manu Mathur, who many of you, I think, have met and loved. He's based in the UK. He works at Queen Mary University in London, but also in India at the Public Health Foundation of India. And talking about India, oh my God, at the end, I will learn how to use this. Sorry. So in India, we also have Professor Abhishek Mehta at Jamia Millia University, and Manu there as well, and Mirai Chatterjee in Ahmedabad with SIWA. Here in Kenya, we have lovely Professor Regina Mutave, our lovely hosts here at the University of Nairobi. In Brazil, Federal University of Pernambuco, Paulo Goes, and this is me, Carol, in Bogota, Colombia. So this is an overview of our core program. So I don't have time to go into all the details, but I will go through the main features of it. So as I said before, our general aim is to contribute to reduce oral health inequalities and, importantly, to improve access to dental care, especially with a focus on disadvantaged communities across our countries. And we have 3 research packages. So we have the first one is focused on oral health inequalities, the second one on commercial determinants, and then the third on systems reform. And the idea for us is to understand how these inequalities are produced and test co-produced interventions to tackle those inequalities, also in terms of the commercial determinants, to uncover the strategies that the industries use to promote the products and to influence oral health policy, research agendas, and so on. And in terms of the system reforms, to assess the barriers accessing dental care, again, with a focus on disadvantaged communities, and to co-produce strategies to improve that access. We also have central components here. So we have the community engagement and involvement that might be the more exciting and novel component of our project. And we will hear more about that from Professor Regina Mutave, the training and capacity building, and the monitoring, evaluation, and learning. We would like to share, this is very nice for us. We have exactly 1 year ago in October in India, we have our launch event in New Delhi. So this is the photo on the left side. It is the photo on this side. And then over there, you see a photo of us. We visited the Navapura community, Navapura village, close to Ahmedabad, where we had the pleasure of having a very engaging, humbling conversation with community members there. And actually, earlier this week, we also had the opportunity to have this exchange, enriching exchange with the community in Nairobi, one of the communities taking part in the core project here in Kenya, in Nairobi. Okay, now let me give you a little bit more details about the content of our research work packages. So in the first one, we have 4 studies, and those are a combination of secondary analysis of nationally representative data, nationally representative surveys, also qualitative research, and simulation modeling using also nationally representative data. I will give you more details about this as an example later. And the last one is the co-development of those interventions I was mentioning earlier. In the commercial determinants, we also have a combination of secondary data analysis, qualitative research, and also some Delphi, modified Delphi process to identify opportunities for action. And number 3, work package number 3, we have an assessment of the economic burden of oral diseases. Shall I stop? No. A survey accessing barriers to dental care services, and then qualitative Delphi mixed methods used there to identify opportunities for reform. And finally, similarly to work package 1, a co-development of interventions. Let me give you a couple of examples from work package 1 about the progress we have made so far. So for example, for study 1.1, which is this secondary analysis of nationally representative surveys, we work for this particular study with our partners, our colleagues in Pelotas in Brazil, Professor Alucio Barros and Dr. Francine Costa, and they have produce these beautiful, visually nice images such as this one. This graph is called a Neki plot, showing, in this case, the proportion of adults who have had a dental appointment for prevention in the last 12 months, and you can see by wealth quintiles, and you can see here the comparison across different countries. So in addition to this cross-country comparison, they have also produced beautiful country profiles showing for each of the 44 countries for which they have conducted the analysis, we have conducted the analysis, showing different dimensions of inequalities, isn't it? So geographical inequalities, inequalities by wealth quintiles, by educational level, depending on the data available on for each country. Another example is a study 1.2, is what we call the Unheard Voices on Oral Health. This is an exploratory qualitative study where we have engaged with disadvantaged and vulnerable groups across all the countries to explore their views about oral health, their experiences of oral health problems, how that affect their daily lives, and also their experiences accessing oral health services or not. We will hear more about this study as well in the following presentations. And for study 1.3, these are just examples of what we have been doing. We work for this study with our colleagues and dear friends Ankur Singh and Marco Perez at University of Sydney and National Dental Research Institute of Singapore. And for this study, what Ankur and colleagues do is they use this, again, national representative data, also demographic data, mortality data for the different countries, and they compare different upstream interventions to see how those will affect population health, population oral health, and also inequalities. So the first analysis was a proof of concept. It used US data and it compared business as usual, sugar sweetened beverage tax, sugar tax, so taxing both sugary drinks and foods, and motivational interviewing. And they compared the impact of these four scenarios on population oral health and inequalities. So you see some of the results here. So the impact of those interventions, upstream interventions, by income level as well. So those are just some examples of the research we have been doing. As I said before, maybe one of the more exciting components of our project is the community engagement and involvement one. You see here some photos from our communities in the 4 countries, and we have been learning a lot from them. We have been learning how these upstream political, commercial, and social determinants on oral health are embodied by there, and they are lived by there on a daily basis and impact their lives the way they experience oral health problems as well. Another component, which is a central component of our program, is the training and capacity building one. And within that one, we have different strategies. You can see here a photo of the Brazilian team, Professor Paulo Goes and his team in Pernambuco. So we first conducted a training needs assessment. So we identified training needs in the different countries. And based on that, we constructed action plans. So training and capacity building and strengthening action plans for each country and across the program, a whole one. And based on that, we are currently conducting training courses, both online, so webinars, and also in-person courses. We also have the MSc studentships. So one student from each country got the MSc studentship. So we have now 4 students, 2 at the University of Glasgow, 2 at UCL, who are starting their MSc studies, and we are very excited about that. We also have the mentorship program and the community training events, which are linked to the community engagement and involvement component. If you want to know more about us, this is just an overview. You will hear more from us in the following presentations, but also please visit our website, get in touch, drop us an email, and we also have some social media presence on LinkedIn. We have the YouTube channel where all the webinars, both at country level and the webinars organized at UCL, where all of us take part also, are there, so you can watch them. And we also have the By Sky account. With that, I will finish. Thank you very much for being here, for attending our session. Asante Sana, and we'll hear more from Professor Regina. Thank you very much. Oh, from them first. Sorry, them first.